Hey, it's Mike from Savvy Nomad. In today's video, we're going to cover one of the most confusing topics for Americans retiring abroad, and that is your Medicare coverage while you're overseas. If you're planning a move outside the US, then you might assume that your Medicare coverage continues while you're abroad. Unfortunately, that's usually not the case. Today, we'll go over exactly how Medicare does and does not cover you as an expat. But before we do that, do us a favor, hit that like button. It just really helps us out in the algorithm so we can get this content to more people who really need to hear it. Now let's dive in. As we alluded to earlier, if you're wondering if you're still covered by Medicare while you're traveling outside the US, the short answer is usually you are not. Medicare is a US health insurance program designed for people age 65 and older, as well as certain younger individuals with disabilities. Medicare benefits are almost exclusively limited to benefits received while in the US. So that means if you're living full-time in Portugal, Costa Rica, Thailand, or anywhere else abroad, Medicare will not pay for your health coverage. Everything from doctor's visits to hospital stays to prescriptions, those are all paid for out of your pocket unless you have some other form of coverage. There are only a few narrow exceptions to this, such as if you're traveling in the US and an emergency occurs, but the closest hospital happens to be in Canada. Also, if you're on a cruise ship within US territorial waters, within 6 hours of a US port, Medicare coverage will still apply. In these cases, Medicare may cover Part A, which is inpatient hospital care, as well as Part B, medical emergency ambulance and doctor services you get immediately before and during your inpatient stay. However, Medicare generally won't cover things like dialysis treatments, prescription drugs purchased outside the US, return ambulance trips home, care received after the coverage hospital stay ends, and any care received on the cruise ship if the ship is more than 6 hours away from a U.S. port. One workaround is that some Medigap policies offer coverage for emergency medical care when you travel outside the U.S., specifically Medigap plans C, D, F, G, M, and N. Those plans do provide this benefit. Now, keep in mind, these plans typically cover 80% of the billed charges for certain medically necessary emergency care outside the U.S. after you meet a $250 deductible for the year. Coverage applies if the care begins within the first 60 days of your trip. Note that Medigap policies do not cover long-term care, vision, dental, hearing aids, or prescription drugs. Another option you might look into for if you're an older expat are Medicare Advantage plans. These Part C policies are offered by private insurance companies that are approved by Medicare. Medicare Advantage plans cover all emergency and urgent care services that original Medicare covers, and in some cases you might be able to get coverage for non-emergency care outside the US. However, this does vary by plan, so you really need to check with your insurance company to understand your coverage while you're outside the US. One example is Blue Cross Blue Shield of Massachusetts. Their Medicare Advantage PPO plans include a visitor travel program that offers emergency care abroad. However, if you plan on being abroad for more than 6 months, then you might be disenrolled from the plan and returned to original Medicare coverage. Certain health partners and Aetna plans provide emergency and urgent care coverage during international travel. Again, coverage details and limitations vary, so it's important to check with the companies directly. At the end of the day, you're probably going to need some sort of alternative healthcare coverage as an expat over 65. One option is just get local health insurance. Many countries allow foreigners to buy into their public healthcare systems, and the costs are often much lower than the costs in the US, sometimes under $200 a month. Quality varies, but in Europe and parts of Asia, it can be quite good. There are also private international insurance carriers like Genki, Cigna, IMG. Those offer long-term plans for expats over age 65. Many older expats end up using several layers of coverage. Maybe they get a local healthcare plan, and keep their Medicare and also get something supplemental in case they require emergency transport to the US. There are a lot of directions you could take this. It really comes down to your own personal situation, what your own needs are, and what your budget is. Now, you might be thinking, well, Medicare is not going to help me overseas, so why should I bother enrolling? But we would strongly advise expats to stay enrolled in the program. For one, if you try to drop Medicare and enroll later, then you're going to face lifetime penalties. As an example, delaying Part B enrollment can raise your premiums by 10% for each year that you were eligible but not enrolled. Now, a lot of expats just say to themselves, well, I'll just take that hit if I end up coming back to the US. So it's up to you, but keep that in mind. Life is unpredictable. You really never know when you're going to end up needing to come back to the US for an extended period. So in that sense, keeping Medicare is kind of like getting an insurance policy for future unknowns. Now, if you turn 65 while abroad, then you may have a special enrollment period to sign up for Part B and Premium Part A. Remember that when it comes to Medicare enrollment, in many cases, you must have a U.S. residential address on file. This presents a big hurdle for a lot of expats because many government agencies and insurers won't accept a P.O. box or a foreign address. Now, if you don't have a friend or a relative's address that you can use, then another workaround is to use our domicile service here at Savvy Nomad, where we specialize in obtaining real residential addresses for expats and retirees. All of our addresses are in Florida, which has no state income tax, and we handle the paperwork and coach you through the process. When it comes to healthcare, we have staff that can help you find an insurance plan in the US that's right for you. So if you're interested, make sure you check that out. Link is in the video description. And if you do sign up with us, make sure you use the code YouTube for a discount. That's it for today. So if you enjoyed this video, make sure you hit that like button. It really helps us out in the algorithm. And if you want to hear more nomad tax tips, expat financial strategies, subscribe to the channel. We're always putting out new content. And we also recently launched a weekly newsletter, Americans Abroad. Check that out. Link is in the video description. Until next time, safe travels and happy tax planning.